Understanding Gastroesophageal Reflux Disease, GERD. Gastroesophageal reflux disease, commonly known as GERD, is a chronic condition that affects millions of people worldwide. It's a digestive disorder that causes stomach acid to flow back into the esophagus, leading to uncomfortable and sometimes painful symptoms. This article will provide a comprehensive guide to GERD, including its causes, early warning signs, risk assessment, symptoms, and diagnosis. Causes of GERD. GERD primarily occurs due to a weakened lower esophageal sphincter, LES, the ring of muscle between the esophagus and stomach. Several factors can contribute to the weakening of the LES, such as obesity, smoking, and certain medications. Hiatal hernias can also increase the risk of developing GERD. Other contributing causes may include dietary factors. Consuming spicy or acidic foods, chocolate, caffeine, and carbonated beverages can trigger GERD symptoms. Alcohol and tobacco use. Excessive alcohol consumption and smoking can relax the LES, making reflux more likely. Pregnancy. Hormonal changes and increased pressure on the abdomen during pregnancy can lead to GERD. Delayed stomach emptying. Conditions like gastroparesis, where the stomach takes longer to empty, can contribute to GERD. Early warning signs and risk assessment. Identifying early warning signs and assessing risk factors for GERD is crucial for timely intervention and management. Risk factors may include family history, obesity, or a sedentary lifestyle. Early warning signs to watch for include frequent heartburn. Occasional heartburn is common, but if it becomes a regular occurrence, it may be an early sign of GERD. Regurgitation, the sensation of stomach contents coming back into the throat or mouth. Chronic cough, a persistent cough, especially at night, can be a symptom of GERD. Difficulty swallowing, known as dysphagia, this can be a sign of esophageal damage due to GERD. Chest pain, GERD-related chest pain can mimic symptoms of a heart attack, and should always be evaluated by a healthcare professional. Symptoms of GERD. GERD symptoms can range from mild to severe and may include heartburn, a burning sensation in the chest, often after eating. Regurgitation, the feeling of stomach contents coming back up into the throat. Chest pain, GERD-related chest pain can be sharp and uncomfortable. Difficulty swallowing, known as dysphagia, it can indicate esophageal damage. Chronic cough, a persistent cough, especially at night. Hoarseness, changes in the voice may result from irritation to the vocal cords. Asthma, GERD can trigger or worsen asthma symptoms. Diagnosis of GERD. Diagnosing GERD typically involves a combination of methods, including a review of symptoms, medical history, and physical examination. In some cases, additional tests such as endoscopy, pH monitoring, or esophageal manometry may be necessary to confirm the diagnosis. Understanding GERD in children and infants. Gastroesophageal reflux disease, GERD, is not limited to adults, it can also affect infants and children. Understanding how GERD manifests in younger individuals and knowing how to recognize and manage it is essential for parents and caregivers. In this section, we'll provide insights into GERD in children and infants and offer guidance on recognizing and managing this condition in young individuals. GERD in infants. Common symptoms. GERD in infants often presents with the following symptoms. Spitting up, it's normal for infants to spit up after feeding, but frequent, forceful spitting up may be a sign of GERD. Irritability, infants with GERD may become fussy, especially during or after feeding. Difficulty feeding, refusing to eat or showing signs of discomfort while feeding can be indicative of GERD. Arching the back, some infants with GERD arch their backs during or after feeding due to discomfort. Poor weight gain, infants with severe GERD may experience poor weight gain. Managing GERD in infants. If you suspect that your infant has GERD, it's crucial to consult a pediatrician. Here are some general strategies for managing GERD in infants. Feed in an upright position. Feeding your baby in an upright position can help reduce the likelihood of acid reflux. Frequent, smaller feedings. Offering smaller, more frequent feedings can be easier on your baby's digestive system. Burp your baby. Make sure to burp your baby after every feeding to release any swallowed air. Elevate the crib. Elevating the head of the crib slightly can help reduce nighttime reflux symptoms. GERD in children. Common symptoms. GERD in children can present differently from adults. Common symptoms may include heartburn. Children with GERD can experience heartburn, but they may not always be able to describe it accurately. Regurgitation. Like in adults, regurgitation of stomach contents is a typical symptom. Chronic cough, a persistent cough, especially at night, can be a sign of GERD. Difficulty swallowing. children may have trouble swallowing or experience the sensation of food getting stuck in their throat. Irritability or behavioral changes. GERD can lead to irritability, mood changes, or difficulty concentrating in children. Managing GERD in children. Managing GERD in children requires a multifaceted approach. Here are some key steps. Dietary changes. Adjusting your child's diet to avoid trigger foods and adopting a healthy eating pattern can be beneficial. Medications. Your pediatrician may recommend medications to reduce stomach acid or improve digestion. Lifestyle modifications. Encourage a healthy lifestyle with regular physical activity and stress reduction techniques. Consult a pediatric gastroenterologist. In complex cases or when symptoms persist, consulting a specialist may be necessary. Complications and long-term effects of GERD. Untreated GERD can lead to various complications, some of which may have long-term effects on one's health. Esophagitis. Chronic acid exposure can cause inflammation and damage to the esophagus, leading to esophagitis. Barrett's esophagus. In some cases, GERD can lead to a condition called Barrett's esophagus, which is a precancerous change in the lining of the esophagus. Respiratory issues. Aspiration of stomach acid can lead to respiratory problems like asthma, chronic cough, and pneumonia. Dental problems. Acid reflux can also affect dental health, causing enamel erosion and other dental issues. Real-life experiences and success stories. To provide a more holistic perspective on GERD, let's hear from real individuals who have experienced GERD and learn about their journeys in managing and overcoming this condition. Real-life experience 1. Sarah's journey with GERD. Sarah, a 34-year-old mother of 2, shares her experience with GERD. She discusses the challenges of managing GERD while juggling a busy family life and offers insights into how lifestyle changes have made a significant difference in her daily comfort. Real-life experience 2. John's battle with severe GERD. John, a 48-year-old engineer, opens up about his struggle with severe GERD and how it led to complications like esophagitis. He shares his decision to undergo surgery and the positive impact it has had on his quality of life. Success story 1. Lisa's triumph over GERD. Lisa, a 27-year-old nurse, talks about her journey from frequent heartburn to successfully managing her GERD. She emphasizes the importance of dietary modifications, regular exercise, and the support of her healthcare provider. Success story 2. Mike's GERD transformation. Mike, a 40-year-old teacher, narrates his transformation from chronic acid reflux to a GERD-free life. He attributes his success to a combination of medication, lifestyle changes, and dietary adjustments. 5 unique FAQs. FAQ 1. Can GERD be cured completely? GERD can be effectively managed, but it's generally a chronic condition that may require ongoing care and lifestyle adjustments. While some individuals may experience symptom relief to the point of remission, a complete cure is less common. FAQ 2. Are there natural remedies for GERD? Natural remedies like ginger tea, aloe vera juice, and dietary modifications can provide relief for some GERD symptoms. However, consult a healthcare professional before relying solely on these methods. FAQ 3. Can GERD lead to cancer? Untreated GERD can lead to complications, including Barrett's esophagus, which is a risk factor for esophageal cancer. Regular monitoring and appropriate treatment can reduce this risk. Conclusion. In conclusion, gastroesophageal reflux disease is a chronic condition that can significantly impact an individual's quality of life. However, with the right combination of early detection, risk assessment, understanding of symptoms, and inspiration from real-life experiences and success stories, GERD can be effectively controlled, allowing those affected to lead a fulfilling life. Our course will provide you more information about GERD. Your health matters. Quali.health